Every month, the female body goes through a remarkable and beautifully organized cycle. This process, known as the menstrual cycle, prepares the body for the possibility of pregnancy. It begins deep inside the brain, where the hypothalamus and pituitary gland release hormones that signal the ovaries to begin their monthly rhythm. As the cycle starts, follicles inside the ovaries begin to mature. One of these follicles will grow larger than the others and eventually release an egg, a moment called ovulation. At the same time, the uterus prepares itself by gently thickening its inner lining, known as the endometrium. This soft, nutrient-rich layer forms a cushion ready to support a fertilized egg. If fertilization does not occur, the body begins to shift. Hormone levels drop, signaling the uterus that pregnancy has not taken place. In response, the endometrial lining slowly detaches. This natural shedding is what becomes menstrual flow. During this process, the muscles of the uterus contract rhythmically to help release the lining. These contractions, influenced by natural chemicals called prostaglandins, can cause the cramps many women experience during their periods. Although uncomfortable, these contractions are an essential part of the body's normal rhythm. The menstrual flow then travels from the uterus through the cervix and exits the body, marking the start of a new cycle each month. This system works in perfect coordination. Hormones, ovaries, and uterus working together with incredible precision. Understanding the menstrual cycle gives us deeper respect for the complex biological processes that support reproductive health. This cycle is not just a monthly event, but a powerful, beautifully designed system that plays a vital role in the human body.